It's time again to spin the big wheel of birth. It's our little negative childbirth education in a game show format. Ready? Let's do it. Ooh, hydration. Today we're going to talk about hydration. Okay, hydration. Keeping yourself hydrated is super important. Now, it's not just for labor and birth. It's actually during pregnancy, labor, birth, and postpartum. And it is so important. It is actually something that we've seen sometimes women can start getting contractions, early contractions, or go into labor early if they aren't properly hydrated. So when you're pregnant and you feel like you're drinking a lot, keep it up during labor and birth because it is so key. And sometimes we'll even see contractions in labor start acting weird, being in a weird pattern, slowing down, and hydration might be the key. So a couple ways you can hydrate. Obviously, you can drink water. You can eat foods that are very hydrating, fruits and in addition to your fluids. A good thing in labor is often to switch up a water with maybe an electrolyte drink. You might want to add something like coconut water or a Gatorade, a Powerade, a Recharge to your water or as an addition to water. And then sometimes in labor, if your body is just not hydrating well, or you are vomiting a lot, you might need to get IV fluid hydration through IV fluids. And so that would just be a bag of IV fluids that is given and controlled by your care provider. And the other thing to note is if you are being given IV fluids in labor, it's still good to keep that water nearby and have sips of water, unless you have an epidural, and then you will change from water to ice chips. So after an epidural, you're hydrated through your IV bag and your epidural, and they don't want you to have a lot of extra fluid coming in. So hydration is really important in labor. Partner tip, instead of asking your partner in labor if they want water or if they're thirsty or if they need a drink, just have a bottle or a cup with a straw. A straw is key because, as we know, drinking from a straw is so much easier. So instead of saying, hey, are you thirsty? Just take the bottle and put it right up, the straw right up to her lips after a contraction. Contraction ends, couple seconds, put the straw up and just offer a drink that way. And the great thing about that is that she doesn't have to think about it. She just can sip it and be done. And little sips after every other contraction, every third contraction is really important. And it goes nicely with what we talked about yesterday, which is the bathroom. So visiting the bathroom often is great, and you will need to if you are keeping properly hydrated. So pregnancy, hydration, obviously really important. Labor and birth, partners, that's a tip for you. And then the last thing, but not the least, is postpartum. So if you are nursing a baby, if you're feeding a baby, you have to stay hydrated. And it is so important before you sit down to have that feeding to make sure that you have a cup of water next to you. With the straw is easier too, because if you're worrying about a latch, you can just reach up, drink with the straw, and put it back down. Partners, it's a great thing if you look over and she's nursing and doesn't have any water next to her. Go grab some with the straw and put it on a table next to, or offer it if there's not a table nearby, because for proper milk supply, you really need to stay hydrated as well. And it can feel kind of like a chore. I've heard people who don't like drinking water complain or mention that it's really a bummer and a chore to always have to be drinking water and then always have to be going to the bathroom. True story. But it's super important for these phases of labor, birth, and postpartum. Thanks for joining. Bye, guys.